I'm a hematologist, medical oncologist for the past 23 years. I grew up in South Philadelphia. Been a Philadelphia guy all my life, although I did go to medical school in Kansas City for 4 years. Got a little taste of the Midwest. Great barbecue, great steaks, but not so good Italian or pizza, and it was tough for a South Philly guy in a one-horse town. And then I came back to the Philadelphia area to do my training. I did osteopathic internship in Chester, and then did my internal medicine at the University of Pennsylvania Presbyterian Hospital, and then was fortunate enough to do fellowship at Thomas Jefferson University. I was fortunate enough to work with sort of the godfathers of hematology, the guys who wrote the textbooks about hematological disorders, either benign and malignant. And I had these guys at my disposal that I was able to learn from, and it really sort of built the foundation of my clinical practice. So basically, this multidisciplinary approach is where everybody, depending on the tumor type, you're in a room with a breast surgeon, a radiation oncologist, a pathologist, and a radiologist, and the patient is presented, and then the radiographical studies are presented, and then everybody sort of weighs in on what's the treatment approach. And like I said, you get everybody's perspective. You get a surgical perspective, you get the radiation perspective, and the medical oncologist, and then when the patient is seen for real, everybody has an idea what the plan is in place, and they almost sort of met the patient even though they didn't physically see them, but they saw their films, they saw their pathology, and an extensive discussion was in place. It's chemotherapy mainly, but the treatment of most cancers have undergone a revolution in terms of targeted therapies, immunotherapies, biological therapies. As time goes on, we're getting a lot more sophisticated. The drugs are getting more sophisticated and more pinpoint, more precise, more targeted, and the patients are benefiting by living longer and having less side effects than pure chemotherapy that we used to use. Tell the patients the same thing you would tell your family member, and treat them as such, and making sure you're returning that phone call when they call, making sure that when they call for a prescription, they get the prescription right away, because you would want your mom to have the prescription right away. You would want your sister to get that call back, especially when there's a test out there looming that they're anxious about.